Hello there. This is Dr. Onoriobe, and I want to speak about sleep apnea. So, today we're going to talk about the mechanisms, the impacts, and the treatment strategies for obstructive sleep apnea. This is an artwork that was done in the 17th century in Rome, and it's attributed to Theodore van Loon or Domenico Fetti of a sleeping girl. So sleep is truly essential, and this art just uh, depicts that fact that when you sleep, you should be restful and the and you should wake up refreshed and ready to go. So during sleep, most of the body's systems are in a state of an anabolic state where you are building, you are helping to restore the immune, nervous, skeletal, and muscular system. So you need a good amount of sleep every time, and most of the times we shut down at night, and when because of the sleep patterns, your body produces melatonin, and once it's time to rest, as you begin to shut down, you should wake up refreshed. The CDC recommends certain amounts of time for different ages to have their sleep. When a baby is born, they usually have 14 to 17 hours. Babies are always sleeping, and if they are not eating or playing a little bit, they are fast asleep, and that is normal for a child to sleep. And it has been said that children who do not have good amount of sleep in their childhood have cognitive problems when they grow up. As you get older, which I believe most of the people watching this presentation right now, between the ages of 18 to 64, you need an average of at least 8 hours of good sleep every night. So, obstructive sleep apnea is a common and serious sleep disorder where the upper airway becomes partially or completely blocked during sleep. On the left hand side here of this diagram, you have like a normal sleep where air flows through the nostrils and through the mouth, go past the uvula just behind the tongue and gets into the trachea down into the lungs, and that is normal. So in sleep apnea, that airway between the uvula and the tongue gets blocked, and this happens for a few seconds during sleep, leading to just pauses. You stop breathing. In OSA, the individual stops breathing for a few seconds to up to a minute, 60 seconds of pause in breathing, and that is not good. Charles Dickens, many years ago, introduced a character in one of his books called the Pickwick Papers. Joe the Fat Boy. This was a character who was always asleep. He was a messenger, and when he goes on an errand, he falls asleep and snores while waiting to just do his work. So he was and he grew up in that time. Charles Dickens actually, opened up something to the physicians of his day, and they called it the Pickwinian syndrome, where it is clinically known as obesity hypoventilation uh, syndrome, that is characterized by the blood carbon dioxide levels are too high due to obesity breathing challenges. So some of the symptoms of the Pickwinian of syndrome is daytime sleepiness. Despite that this individual has slept throughout the night, during the day is feeling sleepy, frequent headaches or dizziness, problems concentrating, there's pulsation of breathing during sleep, shortness of breath, and loud snores. And such individuals also have a high body mass index, and their tiredness and lack of energy is usually the complaint. The prevalence here, about 1 billion people around the world have sleep apnea, obstructive sleep apnea, and most of it is undiagnosed. It affects mostly middle-aged men and postmenopausal women and individuals with obesity. We'll talk about the body mass index in another slide so we can see um, what is your BMI and how it affects sleep, your a good night's sleep. I want to believe that this is a public health concern. 1 billion people, one over seven of the of the entire world, is having the associated risk of cardiovascular disease, metabolic disorders, and just a reduced quality of life. So we're going to define obstructive sleep apnea. It's a disorder, it's a sleep disorder characterized by um, repeated episodes of partial or complete blockage of the upper airway during sleep. The key features are loud, persistent snoring, apnea episodes where there is cessation, stopping, the individual stops breathing. There's oxygen desaturation, and there's fragmented sleep that leads to excessive daytime sleepiness. So you're at work and you're dozing away. You're driving and you're dozing away, and it's been associated with a lot of motor vehicle accidents. The mechanisms behind obstructive sleep apnea. So what happens is that there's a loss of muscle tone in the pharyngeal area during sleep, soft tissue collapse, and there's airway obstruction. The consequences are that there is decreased airflow and oxygen levels, um, sleep fragmentation and frequent awakenings, decreased sympathetic nervous system activity, and it leads to serious consequences if not addressed. So you want to check what is your body, your height. So there's a calculator. Go calculate online. There's online calculators that do BMI. Put your weight and your height, and you'll be able to get in terms of where are you? Are you overweight? Are you obese? Or are you extreme obese? So you need to know that because um, you know an increase in obesity and sleep apnea kind of go together. So in order to just get a good quality of sleep and good quality of life, you probably want to do some weight reduction program that can help you, frequent exercise, and just portion control, and just watching your weight. These are the risk factors for obstructive sleep apnea. So there's obesity and fat deposition around the airway. Um, so individuals also have some anatomical factors. Some people have like large tonsils, enlarged tonsils, elongated uvulars, and deviated septums. If you look at the diagram on the right hand side, you can see the yellow, which is fat. So in an individual who experience apneic episodes of pulsation of breathing during sleep, there is increased fat deposition in the tongue. So once you have excess fat, the body just collects it in different places, and one of the places where fat it gets accumulated is in the tongue. And so once you're sleeping, the airway is reduced because of the enlargement of your tongue that happens just because you are a little bit overweight. So controlling your weight, is going to open up your airway so that you can breathe. One of the other, risk factors is just age. More in males who are above 50, and postmenopausal women. as well as just the consumption of alcohol, the use of sedatives, smoking. If you're taking a muscle relaxant, that is it right there. So your the muscles around your pharynx relax and such that all the tongue collapses towards the back. To make a diagnosis, a clinical diagnosis, so you're looking at the symptoms, you're looking at the signs we just described, you probably want to visit your physician, where your complaint is that okay, or your significant order tells you that you are gasping at night during your sleep. So you need someone. If you're sleeping alone, you probably need to check if you are experiencing. If you wake up tired, then you want to go in for a consult. But loud snoring, choking, and gasping, and the other person, if you have a significant order, they are not able to sleep because because of you have this choking episodes and tossing and turning, and you wake up with and you're sleepy, excessive daytime sleepiness. Mornings you have headaches, you have a dry mouth, a sore throat, just because of that your pulsation and the blockade of your airway during the night. A diagnosis is made um, doing a sleep study. So the physician gets does some clinical assessment, takes history of your sleep, and there's polysomnography uh, test that is done, an overnight sleep study where you sleep and they're connected a um, couple wires to your body, and it gives an indication of how well you're sleeping. Today, there's the home sleep apnea testing where they give you a device, less complicated, a pulse oximeter that calculates your oxygen saturation, and you also have to answer this Epworth sleepiness scale. A group of questions here that are given to you. We're going to go over it briefly. So, in order to calculate the Epworth sleepiness scale, uh, is from 0 to 3, where 0 would never doze, slight chance of dozing, moderate chance of dozing, and high chance of dozing. So, would you, when you are watching TV or when you are reading, yeah, what are the chances of you dozing off? When you're sitting inactive in a public place, in a meeting, you are in a board meeting, and in a public place, and you are dozing away. Um, those it counts towards getting a score. You're lying down resting in the afternoon, and you're just like chilling. Before you know it, you are fast asleep. You're a passenger in a car for an hour, and before you know it, you're sleeping. You're sitting and chatting with someone. So that's quite embarrassing. But for some folks, who are just sitting and chatting. Before you know it, they are falling asleep. You're sitting quietly after lunch, without any alcohol or anything, and before you know it, you're falling asleep. Therefore, you, what of when you are in a car? You are driving, and you stop in the traffic for a few minutes, and the next thing you see, you're falling asleep. So you can take this test, and and this scores here can be interpreted as such. So if you have a score of 1 to 6, it shows that you're having enough sleep. If you tend to be sleepy during the day, that's about 7 to 8. If it's your score is about 9 to 15, it means you're very sleepy, and 16 plus, it means you are dangerously sleepy. Always, it's a good test to do. This is a pictorial version of it, where you are sitting and reading, you're watching TV, you are in a public place, you are in a passenger in a car, you are lying down, you are in a car, you stopped for a few minutes. You don't necessarily have to be the one driving, but the fact that you stopped, or you're sitting quietly after lunch and you're falling asleep. The impact of untreated obstructive sleep apnea. So there are cardiovascular effects, hypertension, heart failure, and stroke. scary that just from not having a good amount of sleep, you can develop metabolic implications, diabetes, type 2 diabetes, obesity, and insulin resistance. And you also have cognitive and psychological effects where there's memory impairment, depression, and you're just anxious. All could be the result of not getting sufficient sleep. And there's daytime consequences such as reduced work productivity, an increased risk of motor vehicle accidents. So sometimes individuals have like a brain fog. Why? For just a transient moment, you can't even remember what you were talking about. If you, those are quite serious, and good reason why you want to take care of it. So when you go and get a sleep study, you get a score called the apnea hypopnea index, AHI, which is calculated by the number of uh, apneas, complete cessation, and hypopneas, partial blockage. So the device is able to record partial and complete blockage and is able to calculate a score for you. Your normal score is if you have um, less than five episodes um, of cessation of breathing, less than five, within an 8 hour period of sleep. If you have between 5 to 15, it says that you have mild obstructive sleep apnea. If you have 15 to 30, it means you have moderate, and severe if you have um, greater than 30. So, what are the treatments? So one of the major things is just lifestyle modifications, avoiding alcohol and sedatives, and smoking cessation and weight loss. Get into a weight loss program, do some portion control, some intermittent fasting, whatever it works for you. You want to get into it. So exercise is key um, to getting a good night rest, and developing a good sleep hygiene, I would say, in terms of light. Blue light that comes from computer screens, from phone screens. So when it's getting towards the time you want to go to bed, you want to just start toning it down. How does your room look like? What does the lighting in your room look like? What activities do you do? Do you stretch? Do you just lay and relax? So you just got to come up with a good sleep hygiene, and also the use of positive airway pressure therapies, a CPAP. Some folks have gone ahead and they do undergo surgical procedure to be able to keep the airway patent during sleep. And as a dentist, I'm really concerned about the use of mandibular advancements, these devices. Yeah, this is something that we'll begin to see very common. For most people, they cannot tolerate the CPAP, which is the gold standard. The gold standard is uh, the use of a CPAP machine that maintains the airway patency through constant positive pressure. Most people uh, cannot tolerate this, but many people can, and and improves cardiovascular outcomes and increases quality of life. This CPAP is the first thing to do. Is the gold standard, and but for those who are not able to, or who have a preference of what's to use, there's an oral appliance that the dentist, having requested for a sleep study and given you can a dentist, a qualified dentist, can make an oral appliance that pulls the jaw forward. So if you pull the jaw forward, the tongue comes with it and opens the airway, and you keep this on throughout the night. And most people have very good outcomes from using this mandibular advancement device. In conclusion, here, I want to say sleep apnea can severely impair quality of life in in physical, emotional, and social domains. The symptoms here include snoring, daytime sleepiness, fatigue, loss of interest, decreased libido, and poor concentration. And treatment includes the use of a CPAP, a mandibular advancement device, even surgery. Most of all, lifetime changes such as regular exercise and maintaining a healthy weight, limiting alcohol and caffeine, and quitting smoking. You do that, you're on your way to increasing your quality of life, and just keeping alive, and having a good healthy life. Anyway, thanks for watching, and looking forward to bringing more topics to you.